Welcome back, everyone, to the deep dive. This time, we're taking a closer look at infectious diseases, but from a pretty unique angle, that of paramedics.
Oh, yeah, definitely a crucial perspective.
We've got a textbook chapter here all about these diseases and some real-world case studies, the kind of situations paramedics find themselves in all the time.
Right, right.
So whether you're thinking about a career in medicine or just want to be more aware of, health risks,
hmm
this deep dive's for you.
It's interesting, because most infectious diseases, they aren't really life-threatening,
Right.
but some can be quite serious.
Oh, absolutely.
We're talking about HIV, hepatitis B, bacterial meningitis.
Yeah, yeah.
Situations where knowing what to do and knowing it quickly can really make all the difference.
No doubt about it. So, right away, that raises the stakes. These aren't just, things we read about. They're real-life situations, real consequences.
For sure.
And that kind of leads us to the unique position of paramedics, right?
Right.
They're often the first ones on the scene dealing with these infectious diseases in all sorts of environments.
Yeah, exactly. And that's where the challenge is, right? So imagine being called to a home. Someone's having a seizure.
Oh, wow.
Your mind's racing, trying to figure out what's causing it.
Right.
But also you're thinking, could this be contagious?
Yeah.
How do you balance providing that urgent care while also making sure you and everyone else stay safe?
Yeah. That's a tough one. That's the kind of stuff these case studies really highlight.
They do, yeah.
Speaking of, complex cases,
Yeah.
our first one introduces us to Hatsuyu, a 36-year-old woman.
Okay.
She's had this cough for 3 weeks now, won't go away. It's gotten so bad she's also short of breath and has a fever. So putting yourself in the shoes of the paramedic, what's your gut reaction to this?
Okay, well, the first thing that comes to mind is, some kind of respiratory infection. Seems pretty straightforward. There are a few things that make me pause.
Okay.
Tsuyo traveled to Canada recently, and she was visiting some fish markets.
That's interesting.
That travel history, it makes me think about tuberculosis, TB.
TB. Okay. Now that's not your average cold, right? What makes TB such a concern here?
Well, TB is really contagious, and it can be so hard to treat,
Right?
especially now with, all these antibiotic-resistant strains we hear about.
It's true.
And there's still a lot of stigma around PB, which unfortunately makes some folks hesitant to get help.
Yeah. Makes sense to be cautious then. So the paramedics are thinking TB. What are they looking for in that initial assessment?
Right. They'll check her vitals, of course, temperature, heart rate, all that.
The basics.
Yeah, exactly. And in her case, they found a mild fever, heart rate was a bit high, and her breathing was shallow. Now, those findings, they could fit with a regular respiratory infection, but they don't rule out something more serious, like TB.
So it's a bit of a waiting game at this point until they can get more info,
Yeah, in a way. The paramedics, they have to rely on their training and their experience to make judgments in the field. They'll look at everything, the patient's history, the symptoms, the whole picture.
Makes sense. Okay, let's move on to case number 2. This one's pretty different. We've got Sarah, a 5-year-old girl having a seizure, and her mom's not feeling great either.
Yeah.
So what are the challenges when you're dealing with a young child like this?
It's always more emotionally charged when it's a child, right? And then when the parent's also sick, it just adds another layer of complexity. Immediately makes you think, could this be something they both caught?
Right, yeah. Okay, so the case tells us Sarah had an ear infection last week. She's been really tired, had headaches, and now this seizure. Vitals are mostly normal, just a slightly elevated heart rate.
Yeah.
What jumps out at you from all that?
The ear infection combined with the neurological stuff, especially the seizure, it makes me think about meningitis.
Meningitis.
Yeah. It's an inflammation of the membranes around the brain and spinal cord. It could be caused by bacteria or viruses.
And why is the ear infection important here?
Well, sometimes, particularly in young kids, ear infections can actually lead to bacterial meningitis, which is, very serious, potentially life-threatening. The inflammation can spread from the ear to those membranes, the meninges, and cause all sorts of neurological problems.
So unlike, a simple cold, meningitis is a much more urgent situation.
Oh, absolutely. Bacterial meningitis, it can progress so quickly. Any delay in treatment, it can have devastating effects.
Wow. This really shows how symptoms that seem totally unrelated, like an ear infection and a seizure, can actually be connected to something much bigger and more serious.
Yeah, it really highlights how important it is to look at the whole picture, not just individual symptoms in isolation.
So we've seen how paramedics approach two very different cases. Now, I want to talk about how they keep themselves and their patients safe. What kind of standard procedures are in place?
Well, paramedics follow what are called universal precautions. They're a set of guidelines, basically, to prevent infections from spreading.
Right.
Things like wearing gloves and masks, properly disposing of any contaminated materials, and of course, being really diligent about hand hygiene.
I mean, these precautions, they might seem pretty basic, but they're so important for stopping that chain of infection.
They really are. It's about protecting everyone involved, the paramedics, their patients, other healthcare workers, and the community at large.
So, what are some key takeaways for our listeners? What can they do in their everyday lives to stay safe and healthy?
Okay, well, first, it's really important to be aware of your own health and your travel history, too. So if you're going to the doctor, be sure to tell them about any recent illnesses, anything you might have been exposed to, any travel, even if it seems unrelated.
Give them the whole picture so they can make the best decisions for your care.
Exactly. And don't be afraid to ask your doctor about their infection control practices. It's okay to ask about things like hand hygiene protocols, how they sterilize equipment. You have a right to know.
Absolutely. Be an informed patient. Advocate for your own safety.
Right. And never, ever underestimate the power of basic hygiene. Simple things like washing your hands regularly, covering your coughs and sneezes, staying home when you're sick.
It's the basics.
Yeah, those are your first lines of defense. They really can have a huge impact on public health.
All right, so we've talked about the basics of infectious diseases, the challenges that paramedics face. What are your main takeaways so far?
I think what's really struck me is how complex infectious diseases can be. It's rarely a simple diagnosis.
Yeah.
You often need to think like a detective, put all this to pieces together.
And the role of paramedics in this whole process is so crucial. They're often the first contact, and their ability to assess the situation, figure out the priorities, and manage potential infectious diseases, it's really impressive.
They really are like walking encyclopedias of medical knowledge. And their commitment to patient safety is just remarkable.
Before we wrap up this part of our deep dive, I want to leave our listeners with a question to think about. Given what we've learned today, what do you think are the biggest challenges paramedics face when it comes to infectious diseases? What innovations or changes could help them better protect themselves and their patients in the future? We'll dive deeper into those questions in the next part of our deep dive, but for now, I want to leave you with that thought.
It is a great question. Really gets to the heart of some of the big problems in healthcare. Infectious diseases, they're always changing. New threats popping up. So yeah, staying ahead of the curve, that's a major challenge.
It's like a constant race, isn't it? So what are some of the specific hurdles that paramedics might run into, with things changing all the time?
Well, one of the biggest is just the sheer number of different infectious diseases they could encounter.
Right.
I mean, one call could be a common cold, the next something totally rare, something they've never even heard of. And they have to make decisions fast with not a lot to go on.
Yeah, and on top of that, sometimes the symptoms of different diseases, they overlap.
Exactly. Makes it even harder to figure out what you're dealing with.
Yeah, like a puzzle with missing pieces.
It is, yeah. And then there's the risk, right? The risk they take every day. They're right there with patients who could be, coughing, sneezing, bleeding, all of that.
Right.
So that puts them at risk of getting infected themselves, especially if they don't have the right protective gear.
And that risk has got to be even higher in situations where resources are scarce, right? Like in a remote area or during a natural disaster or something.
Oh, absolutely. It really shows you how brave and selfless these first responders are.
It does. And it's not just the physical risks, right? There's the emotional toll, too.
Yeah.
Imagine having to deal with a child with a really contagious disease, maybe even fatal.
Yeah.
That weight of responsibility, the empathy they must feel for their patients, that can't be easy.
It can't. No, you're absolutely right.
And then on top of all of that, there's, constantly having to stay up to date. New treatments, new pathogens, drug resistance patterns changing all the time. It's a lot to keep track of.
It really is. Paramedics have to be like walking medical textbooks, always learning, always adapting. There's no easy feat.
So given all of those challenges, what are some potential solutions, things that could help paramedics and improve patient care?
Well, one thing that I think has a lot of potential is rapid diagnostic testing. Imagine having a device, something portable, that can quickly identify the exact germ causing the infection.
Right there on the spot.
Right there. It would be incredible.
It would be a game changer. They could make better decisions about treatment, isolation, all of that right away.
Exactly. Could even prevent unnecessary hospitalizations. and maybe even help slow the spread of infection.
What about improvements to, the protective gear, PPE? Could new technology make that more effective, easier to use?
Oh, for sure. Developing PPE that's lighter, more comfortable,
Yeah.
but still just as effective, that would be huge. Imagine gear that can adapt, adjust to different situations, different levels of risk.
Yeah, that would be amazing. And of course, ongoing training is super important.
Absolutely.
Paramedics need to have the latest knowledge, the latest skills to deal with these ever-changing diseases.
I completely agree. And maybe things like simulations or virtual reality training could play a role. Give them a chance to practice those skills in a safe environment,
Mm.
build their confidence in those tough situations.
I've heard about those simulations. They sound pretty incredible.
They are, yeah.
What about using technology to connect paramedics with, infectious disease specialists, like in real time?
Oh, that's a great idea. Like, imagine a paramedic being able to video chat with a specialist while they're at the scene. It'd
Wow.
be like having that specialist right there with them,
Oh,
giving advice and support, especially in those really complex cases.
that would be amazing. It sounds like there are so many smart people working on some really creative solutions to protect both paramedics and their patients.
There are. And these innovations, they're going to be even more important in the future.
Right.
With climate change, globalization, new drug-resistant pathogens, all of that, it's creating the perfect conditions for infectious diseases to spread.
Yeah, that's a good point.
So the role of paramedics is more important than ever.
Okay, so let's go back to our cases. We have Hatsuyo, who might have tuberculosis,
Right.
and Sarah, who might have meningitis. What happened next?
All right. So with Hatsuyo, her vitals, remember,
Yeah.
mild fever, high heart rate, shallow breathing.
Yeah.
Those fit with a respiratory infection, but they don't necessarily mean it's TB.
Right. Still a bit of a mystery.
Yeah.
So what precautions did they take during transport just in case it was TB?
Well, because they suspected TB, they took extra precautions, wore masks and gloves, and made sure Hatsuyo had a mask on too.
Makes sense. Better safe than sorry.
Exactly. So at the hospital, she had more tests done, a chest x-ray and sputum cultures.
To confirm or rule out TB?
Right, exactly. And what about Sarah? Her case was really concerning with her being so young and the possibility of meningitis.
Yeah, for
Yeah.
sure. So what happened with her?
Well, with those symptoms,
Mm.
she was transported to the hospital right away.
Immediately.
Yeah, bacterial meningitis can be so dangerous, especially for little kids. So every minute counts.
I bet that was a stressful ride for both Sarah and her mom.
Oh, I'm sure it was. And the paramedics had to be extra careful with her. Not jostle her too much, keep things quiet and dim.
Right.
Anything that could make her condition worse. They wanted to create a nice, calm environment, help stabilize her on the way to the hospital.
So it's not just about speed, it's about creating that safe and supportive environment too. What did they do when they got to the hospital?
At the hospital, they did a lumbar puncture. It's also called a spinal tap. Basically, they take a sample of the fluid that surrounds the brain and spinal cord.
To test it.
Yeah, it's the best way to diagnose meningitis. They look for signs of infection in that fluid, and that helps them tell the difference between bacterial and viral meningitis.
Which is important because they're treated differently,
That's
right?
very important.
So it seems like both Hatsuyo and Sarah's cases really show how important paramedics are. They stabilize the patient and get them to that higher level of care where they can get a diagnosis and be treated.
They do. It's like they're running a relay race, and they're the first runner.
That's a great way to put it.
They hand off the baton to the hospital team.
Right.
But it's more than just transport.
Yeah.
It's assessment, quick thinking, and compassionate care, all in those first few critical moments.
Yeah, absolutely. Okay, so now let's talk a little bit more about tuberculosis and meningitis specifically. Can you explain a little more about TB and why it's such a serious health threat, especially today?
All right, so tuberculosis, or TB, is caused by a bacteria, Mycobacterium tuberculosis. It mainly affects the lungs, and it spreads through the air when an infected person coughs or sneezes. Those bacteria, they can really damage the lungs, maybe get hard to breathe, causing chest pain, even coughing up blood. And in severe cases, it can spread to other parts of the body, like the brain or the spine.
So it's not spread through like casual contact, like
Yeah.
shaking hands or something.
No, it has to be through the air. Those tiny droplets that come out when someone with TB coughs or sneezes.
Okay, and you said TB can be fatal if it's not treated. Can you explain why treatment is so difficult?
Well, TB is treatable,
Mm.
but it takes a long time.
Right.
usually several months of taking multiple medications.
Wow.
And that can be hard for people to stick with. And if you don't take the medicine consistently, it can actually lead to drug resistance.
Oh, so the bacteria become resistant to the drugs.
Exactly, and then it's much harder to treat. Drug-resistant TB is a big problem worldwide.
So early detection and sticking with the treatment plan are key.
They are, yeah. Okay, so let's switch gears now and talk about meningitis, which is what we thought Sarah might have.
Right.
Can you tell us a bit more about that condition and how it affects the body?
Sure. So meningitis is an inflammation of the meninges,
Uh-huh.
which are the membranes that surround and protect the brain and the spinal cord. That inflammation, it can actually disrupt the flow of cerebrospinal fluid, the fluid that bathes the brain and spinal cord, and that can lead to all sorts of neurological problems.
Okay, so what are some of the typical symptoms of meningitis, and how do they differ from, say, the flu?
Well, meningitis symptoms can range from mild like flu-like things to more severe stuff like seizures, even brain damage, in some cases death. But unlike the flu, meningitis often causes a stiff neck and sensitivity to light and mental changes.
Okay, so those are the red flags.
Yeah, those are the things paramedics would be looking out for.
And we mentioned earlier that meningitis can be caused by either bacteria or viruses. What's the difference between those two types, and why is it important to know which one it is? Okay, so bacterial meningitis is generally more serious. It tends to hit harder and faster. Viral meningitis, on the other hand, is usually milder and often goes away on its own without any specific treatment.
So you don't always need antibiotics for viral meningitis.
Right. But for bacterial meningitis, you do. And you need them quickly to prevent those serious complications.
So figuring out which type it is, that's crucial.
It sounds like getting that diagnosis quickly is really important. You mentioned the lumbar puncture, that spinal tap is the best way to diagnose it. Are there any other tests that paramedics can use in the field?
Unfortunately, not really. There aren't many reliable tests for meningitis that can be done right there on scene, so they have to rely a lot on their own judgment,
Right.
looking at the patient's symptoms, their vital signs, their medical history, all of that.
And making that call.
Yeah, that's why their knowledge and experience is so critical.
It's pretty amazing how they have to make these big decisions with limited information and sometimes limited resources.
It's a real testament to their skill and their dedication.
Definitely. They are really on the front lines of healthcare. And their job, it's only getting more complex, more challenging as these infectious diseases keep evolving.
It's incredible, isn't it, how they're constantly adapting, learning, especially with these new diseases popping up. It takes a lot of skill to handle those situations.
Yeah, it really does. It shows how dedicated they are to taking care of their patients, even when things are uncertain. And it's not just about the physical stuff either. It's
Yep.
about understanding the emotional impact of these diseases too.
That's a really good point. We tend to focus on the medical stuff, but behind every case study, every statistic, there's a person going through something pretty scary.
Exactly.
Yeah.
Imagine being Hatsuyo or Sarah, facing a serious illness, feeling scared, confused. It's a reminder to be compassionate. Empathy is just as important as medical knowledge when you're dealing with infectious diseases.
So true. It's a reminder to all of us to be more understanding and supportive of anyone who's dealing with these kinds of illnesses. Whether it's someone we know or even a stranger, just listening, offering help, it can make a big difference.
And on a bigger scale, knowledge is power. The more we understand about these diseases, the better we can protect ourselves, our families, our communities.
And that's where resources like the textbook we've been talking about and organizations like the WHO and the CDC, they're so important.
Yeah, they're vital.
They give us reliable information, guidance for healthcare workers and for the public.
And they coordinate those global efforts to prevent outbreaks, to detect them, to respond to them. It's a reminder that we're all in this together. We have to work together to deal with these big health challenges.
Absolutely. Collaboration, education, and a lot of empathy. Those seem to be the keys to navigating this whole world of infectious diseases.
Couldn't have said it better myself.
So we've covered a lot today.
We have.
But before we wrap up, I want to leave our listeners with one last thought. We've talked a lot about the challenges that paramedics face, but what about the challenges for the patients themselves? What can we do individually as a society to better support people who are battling these illnesses?
That's a great question. A really important one. It forces us to look beyond the medical aspects and really see the human impact. How can we create a system that's more supportive, more compassionate for people with infectious diseases?
Yeah, it's something to think about. As we've learned today, knowledge is power when it comes to these diseases. The more we know, the better we can protect ourselves, support those who need it, and fight for policies that keep everyone healthy and safe.
I completely agree. Keep learning, keep asking questions, and keep talking about it.
And of course, wash your hands.
Always good advice.
Thanks for joining us on the deep dive. We'll see you next time. Stay curious, stay informed, and stay healthy.